From Kansas.
Madam President, thank you very much, and I thank the senator from Montana for his efforts to see that this legislation be passed. I'm pleased to see that we've been joined in a unanimous way by the United States Senate, Republicans and Democrats working together to see that our veterans receive better care. I, too, want to thank, in addition to the senator from Montana, I want to thank Senator McCain, who is joining us on the floor, the senator from Arizona, but Senator Isaacson in particular, the chairman of the Veterans Committee, and his leadership in seeing that we're here today to bring this legislation across the finish line. The House has passed legislation identical to this, similar to this, and so this is an opportunity for us to get an accomplishment, not for a pat on our backs, but for the improvement in the care of those who served our nation. You know, I've asked this question on the Senate floor before: who of all the people of the United States would you expect to get the best care possible? And while we want every American to have high quality care and access to medical treatment, we certainly want to make certain those who served our country and to whom a commitment was made that they would receive care, we want that commitment fulfilled, and we want it done in a way that is advantageous and easy for our veterans. And the senator from Montana is correct. The Choice Act is a significant improvement in my mind for accessing care. Kansas is not quite as large as the state of Montana, but we're a large rural state, and it is a long distance to a VA hospital. And so Choice was brought into play to try to alleviate the backlog, the lack of providers within the VA, and the wait times that veterans receive, but also to try to satisfy the needs of veterans who live long distances from a VA facility. And so Choice is in place, but it's been a difficult time for many veterans across the country, and certainly at home. It's the most common conversation I have when I'm back in Kansas. And in fact, I had a town hall meeting in Southwest Kansas in Dodge City. And again, it's veterans who either in the public forum will visit about the problems with the VA, particularly with Choice, or they'll line up after or before that meeting to tell me in person they need help. And this legislation does really three significant things, and more is to come. We need a permanent act. This is an extension of the Choice Act that expires on August the 7th. And so continuing the program is the first step while we work out the desired outcome of a long-term permanent program. Secondly, it provides the money through that period of time. It allows the expenditure of dollars to pay for Choice. Third, it eliminates the intermediary, somebody separate from the VA in paying the bills, and that reduces the bureaucracy and burden on our veterans. I just was looking through what we call casework, things that Kansans bring to our office to try to get solved, and front and center is the number of veterans who are being harassed by collection agencies for bills they thought would be paid by the VA through the Choice program, and they're not being paid in a timely fashion. This eliminates the intermediary, the manager of the program, from paying the bills and restores that authority for the VA to write out the check, with the goal of reducing the bureaucracy and paperwork for the veteran and increasing the timeliness for the payment that is due the health care provider, the doctor, the pharmacy, the hospital. And again, as a rural American, many of our providers are struggling. Hospital doors are a challenge to remain open in rural communities across my state. And that long wait for a reimbursement check for services provided months ago also creates a burden upon that hospital, that healthcare provider. So timely payment certainly will benefit the veteran, but it also increases the chances of the stability of healthcare providers in rural communities across my state and around the country. And finally, it increases the ability for the sharing of medical records between the VA and that community healthcare provider. So Choice is in place to help those veterans who need to have care more quickly and who need to have care closer to home. This bill improves that program and extends it, and that's a significant development. And I appreciate the opportunity I've had to work with the senator from Arizona, the senator from Montana, the senator from Georgia, to make sure that we got to the point we are today. and I appreciate my colleagues' unanimous support for the passage of this legislation. Madam President, I yield the floor.
Madam President.